This is the radius. It has three parts: upper end, lower end, and a shaft. Upper end has a disc shaped area. This disc shaped area is articular in nature. Superiorly, it articulates with the humerus and in the capitulum, with the capitulum of humerus. And the lateral side of this articular area is attached with the ulnar radial notch of the ulna, like this. And there is a neck just below the head, and below the head there is a tuberosity that is known as the radial tuberosity. In the shaft there are three borders: the anterior border, the medial border or interosseous border, which is sharp, and there is a posterior border. And in the lower end there is a projected part that is known as the styloid process. And in the anatomical position, this styloid process remains lateral side. And there is five surfaces: anterior surface, medial surface, posterior surface, lateral surface, and the inferior surface. The anterior surface is subcutaneous, and we feel our radial pulse in here like this. And the medial surface is fixed with the lower end of the ulna, and it is known as the ulnar notch in the medial surface. And lateral surface, there is the lateral surface and the posterior surface. Posterior surface has a tuberosity. This is known as the dorsal tuberosity. This around the dorsal tuberosity there are some depressed areas. Through these depressed areas, tendons goes down to the hand. For the naming of the tendon, we can imagine our hand like this. This is the hand, and this is the radius, left hand and left radius. So if some muscle has some attachment in the anterior surface and it attaches in the hand, when there is the contraction of this muscle, that causes the flexion of the hand and flexion of the wrist joint. So all the muscles attached in the anterior surface, they will be the extensor muscle, and all the muscles passes through these groups, this depressed, that will be the extensor. So if some muscle goes from here and goes to the carpal bone, that will be the radiocarpal, and it is the extensor. So it is the extensor group, and the muscle name like this. And the inferior surface, there is two groups. We can see here there are two groups. One is a lateral group and one is a medial group. In the living body, these group are attached with the bones like this, with the bones like this. We in the living body, they remain in contact with these bones. This bone is known as the scaphoid bone, and this bone is known as lunate bone. So the fossa that remain in the lower border of the radius are known as the scaphoid fossa, and there is the lunate fossa. For the anatomical position, when you hold this in the anatomical position, you have to remember that the upper end remains, the disc shape upper end remains the upward, and the projected styloid process remains in the downward. So we can hold like this. This is the anatomical position. But in examination, you may make wrong with this anatomical side determination. You can hold it like this. If you hold in the right hand, and the disc shape upper end remains in the superiorly, and the styloid process remains in the inferiorly. So we can call it the right sided radius, but there is a point, the tuberosity, it should be remain in the posteriorly. So if you hold it in the right hand and name it as a right humerus, it will be the wrong, because this tuberosity is anteriorly. So you have to add another point, that the concavity of the lower end remains anteriorly. So this is the anatomical position of the radius. It is the left radius, and in the body it remains like this. Thank you all.